You worked on planes during the war, is that right?
During the Second World War, Daniel was an aircraft mechanic. Now, in his 80s, he's taking on a new challenge. For the past few years, he's been coping with a Parkinson's type of dementia. Some days he has the occasional outburst and memory lapse, but otherwise Daniel's pretty personable and witty. Care providers at the Middlechurch home where he lives are helping Daniel and other seniors cope with the symptoms of dementia. They've introduced a creative dementia care program that helps care providers identify behavior triggers so they can implement creative strategies like using memories instead of medication.
They're pioneers. They laid the foundation for those of us to follow after. They deserve the respect from us and not to pop a pill, so to speak.
This one here took about 5 days.
It's called Pieces, and it encourages healthcare providers to explore the bigger picture of a resident's past. Not just their health history, but their personal lives, what they did for a living, their family life, and other treasured tidbits that make up who they used to be and who they are today. Since Daniel was a mechanic, he now problem solves with puzzles, while a teacher may mark papers. It's a small step, but replacing medication with routine tasks can help manage challenging behaviors.
And what we find is if we can manage behavior using benign techniques and reduce the medication or get rid of it, we find people have improved quality of life. They perk up, they engage more in their environment, and that also makes it better for families because they can preserve that connection a little bit better with their loved one.
This innovative program didn't happen by chance. It was the result of a research project that Cynthia Sinclair did for her extra fellowship program. Cynthia, who's a registered nurse and a fellow healthcare provider, wondered, what if they could reduce the amount of antipsychotic medication that residents with dementia were prescribed? Well, it turns out those drugs were never meant for patients with dementia. And not only do they not ease behaviors associated with that illness, they often pack powerful side effects.
2 to 3 times increased risk in stroke, heart attack, and death. When you consider the fact that these medications also do not benefit the behaviors, you have to wonder, why are we using this?
Instead of administering pills, a team of nurses, healthcare aides, housekeepers, and even recreational staff meet every week for the huddle. It's a 20-minute brainstorming session where staff come up with creative ways to care for residents who have very complex needs.
He's observant of everybody.
And the results are impressive. Before Cynthia's study, more than 43% of residents at the Middlechurch home were on dementia-related meds. Now, only 25% are prescribed those drugs. That's a 27% reduction. And staff have also seen a decrease in dementia-related symptoms.
Less aggression, less wandering at night.
Right, that looks like that might fit.
It's a rewarding feeling for Cynthia Sinclair. Her mission now is to meet with MPs in Ottawa to advocate for expanding this unique care model to all personal care homes in Winnipeg and perhaps even across Canada, so seniors like Daniel can put those fond memories to use while lessening their dependence on medication. At the Middlechurch home in Winnipeg, Manitoba, I'm Nicole Harris.